Welcome to The Explainer. Today, we're going to play medical detective. We're diving into what seems like a pretty routine procedure, but we'll see how doctors have to basically throw out the rule book when their patients are incredibly fragile, and the stakes, well, they couldn't be higher.
All right, so let's jump right in. The procedure at the heart of our whole story today is called an esophagography. Now, the easiest way to think about this is like a real-time X-ray movie of you swallowing. You drink this special liquid, and doctors are watching live as it goes down, checking out not just the plumbing, but how it's all working.
So in a totally normal situation like what you're seeing here, the patient just stands up, takes a big gulp, and bam, the radiologist gets this super clear view of the whole process. It's pretty straightforward, and it's a great way to see exactly what's going on inside.
Yeah, but that's the ideal world, right? What happens when your patient is, say, in the ICU? They can't stand up. Maybe they're not even conscious. I mean, how in the world do you do a swallowing test on someone who literally can't swallow? This, right here, is where things get really interesting. This is where our medical detective story kicks off.
See, the whole game is changing for this procedure. Radiologists are facing this brand new reality where their patients are just sicker, way more complex, and that means they need smarter, more creative techniques. And get this, the numbers here on this slide tell such a cool story. So while a lot of general real-time X-rays, that's fluoroscopy, are actually being used less, these specific swallowing studies are on the rise. And look at this last bar. The really complicated modified ones, they've shot up by 26%. That's a huge jump. So here's the bottom line. This seemingly old-school test is actually being used more than ever, but on the absolute sickest patients. We're talking about folks in the ICU, the elderly, people fresh out of major surgery. These are patients who just can't do the standard exam.
So that begs the question, how on earth do they pull this off? Well, this brings us to the really ingenious stuff, the clever tricks of the trade that radiologists have come up with to get the answers they need, all while keeping these super fragile patients safe. Okay, let's look at one of the absolute toughest scenarios you can imagine. Your patient has a breathing tube, they're intubated, and they're unconscious. The million-dollar question is, how do you get that special contrast liquid into their esophagus to see what's wrong without it going down the wrong pipe and into their lungs? That would be a disaster. And this image, it shows the first step, and it is absolutely critical for safety. Before they do anything else, see that little balloon cuff on the breathing tube? They inflate it all the way. This creates a perfect seal which blocks off the airway. It's a simple but brilliant safeguard to protect the lungs. Now, since the patient can't just take a drink, the doctors have this really slick 4-step workaround. They guide a tiny tube down, they slowly push the contrast liquid in, and then, and this is the clever part, as they pull the tube back out, it perfectly coats the walls of the esophagus, all while they're capturing images from every angle.
And you can see the whole thing kicking off right here. That little tube is in place, and they're carefully injecting the contrast, which starts filling up the esophagus from the bottom.
Okay, now watch this. As they slowly pull that tube out, you can see the contrast liquid literally painting the inside walls of the esophagus. It's like they're revealing the whole structure bit by bit, all under their complete control. And there you have it, the final product. A totally clear, really detailed picture of the whole esophagus. The exam was a complete success, and it was done safely on a patient who was incredibly vulnerable. It's all thanks to this amazing, modified approach. Okay, so right about now, you might be thinking, hang on, with all our fancy modern tech, why not just use a high-tech CT scan? And that is an excellent question. The answer really gets to the very heart of why this older technique is still so valuable. It all boils down to a really simple but profound difference. Fluoroscopy, that's a movie. It shows you how things are working in real time. A CT scan, that's just a snapshot, a single static picture. The CT can show you the structure, sure, but it tells you nothing about function, and a lot of the time the esophagus isn't even fully open for the picture. Just look at this comparison. It's perfect. On the right, the CT scan kind of vaguely hints at maybe some wall thickening. But then look at the fluoroscopy on the left. Wow, it's not a hint. It's a bright, shining spotlight on a long, really severe narrowing, or what they call a stricture. The movie just blows the snapshot out of the water here. So the main takeaway from this case is that the real-time exam, the esophagram, gave them the critical information they needed for the right diagnosis. It showed them the true length of the narrowing, the severity of the blockage, all these details that the other scan just completely missed. And that's information you have to plan a treatment.
So after all that, what's the big lesson here? What does this whole medical detective story really teach us?
Well, it tells us that being a real expert in medicine isn't just about memorizing a textbook or following a rigid set of rules. It's about being a creative problem solver. It's about adapting on the fly, tailoring what you do to the specific needs of every single patient, especially when they're at their most vulnerable.
You know, the researchers who wrote about these techniques, they put it perfectly. They said these modified studies often provide information that is not readily obtained with alternative methods. Basically, it's knowledge you just can't get any other way. It's irreplaceable.
And all this leaves us with one last big question to think about. In this age of AI and ever smarter automation, how vital is good old-fashioned human ingenuity? I think this story is just a powerful reminder that while technology is an amazing tool, sometimes there is absolutely no substitute for the creative, adaptive, brilliant thinking of a human expert.